So the next panel is again very inspiring, and there's somebody on this panel. I actually have been waiting a long time to meet her, and yeah. So I would love to invite Ms. Sangita Reddy, and she's the managing director at Apollo. Please.
Please come up. Thank you.
And Amit Mookim, managing, sorry. Hello. Hello again. Managing director for IQVIA. And yeah, let's go. Yeah.
Thank you.
No, that's not working.
That's not working?
It should work now. It's working now. Amit, it's working now.
So I won't stand in between this extremely high energy healthcare plenary session. I have had the good fortune to listen to Sangita quite a few times. And she's very kindly come up here to Mumbai despite not feeling very well in the morning. So Sangita, really, really appreciate it. I think I just want to say a few things. One is, all of us would have heard of Apollo, and Sangita has been on the founding team of Apollo Hospitals, which has touched more than 50 million lives across 140 countries. She's helped set up the largest telemedicine network in India. And to me, Sangita has been one of the people who embodies the entire healthcare ecosystem. So when we were thinking of this topic, what will healthcare look like in 2025? We thought it was no better than you, Sangita, to come and share your vision on what it's going to look like, especially with whatever is going on technology, on digital, and of course, on patient care. So over to you, Sangita.
So good afternoon, ladies and gentlemen. Let me first congratulate you for being part of this network, for the energy, for the commitment. I've been to many, many conferences, but I think an entrepreneurs conference kind of always has a higher energy level. So great being here. Thank you very much for the opportunity. Thanks, Amit. I was told to be as entrepreneurial, insightful as possible. So I'm going to give you a few of those. But of course, having been in healthcare for the last 35 years, you do dream, you do hope, you do wish. But where you're going depends on the direction, but also where you began. And let me start with our story. In 1979, my father, Dr. Reddy, had been back from the US for about 9 years and set up a cardiology practice. It was the best that was there in Chennai at that time. Chennai was then called Madras. One day, he saved a young man from a heart attack, gave him the medication, did the whole this thing. But then he knew this person needed to go abroad for heart surgery. He referred him to Dr. Denton Cooley in Houston. The young man, before he raised enough money and got his visa, the $100,000 and the time required for the visa, had a second heart attack and succumbed. That day, he said that Indian doctors all over the world are curing and caring for people. Let's give them the infrastructure to make hospitals and credible surgery and advanced healthcare available to our people. And that was the story of Apollo in 1983. It was inaugurated. In 2007, we had about 8,500 beds. We had completed 150,000 heart surgeries. We were doing new formats in clinics. So a lot going on. It was our 25th anniversary, and Dad called everybody in, and the whole top exec team, about 17 of us, thought he's going to praise us and say, hey guys, great job. And he told us, do you people realize you're relevant to less than 3% of India's population? Go out there again. Innovate. And with that wake-up call, we created REACH, which is the Apollo Rural Empowerment and Access to Healthcare. We started our telemedicine, or we scaled up. We had done telemedicine in 2000, but it was more a showcase project that you show and tell when, some VIPs are coming. Bill Clinton inaugurated this rural villages connected. We were doing good scientific work, but not at scale. With this today, with this call and this love for technology that we truly have, we have over 60,000 teleconsults with the government, but an equal number outside. And then we said, forget these fixed line one-to-one teleconsults. We created Ask Apollo, which is a many-to-many Skype-type environment for telemedicine. Overall, we're doing approximately 2,000 teleconsults a day. And the fact is that we believe in the next 3 years, equivalent to what we have in the physical world, we'll be doing in the virtual world. But besides that, It's a device intervention platform. What can we do with AI? Where are we going with blockchain? We believe the whole environment in healthcare is changing. And let me quickly give you an insight into some of that, because I can share this beautiful vision that our life expectancy is going to go up by 10 years. Our infant mortality will reduce from the current, which it is at about 59 per 10,000, will come down to almost half, to 29. I can tell you that maternal mortality will reduce, that nutritional status should be better. But I think as entrepreneurs, you don't want to just see the end state, you want the path. As your investors say, what's your path to profitability? I think all of you are saying, how do we get there? Because health is one subject that impacts us all. So let me quickly share a few trends and what we think is happening in this space. The first one, I think, is very, very clearly, as someone who in our group has over 10,000 beds, we're very hospital-centric, 180,000 open heart surgeries, largest transplant program in the world. We are saying that care is moving. Care is moving from the hospital to the clinics, from the clinics to the home, and from home to a 24/7 ubiquitous access to healthcare, which will be enabled and driven, enabled by technology, but driven by individuals. And therefore, the next big trend is really that healthcare is becoming more patient-centric, and not just patient-centric, healthcare is becoming more individual-centric. It is the wellness and illness which are merging together into new business models and new paradigms of prevention. And therefore, healthcare is getting definitely more preventive, definitely more proactive with prediction, with the ability to look at clinical parameters and its correlation to incidence of disease, treatment patterns and paradigms, and therefore the aversion of an impending crisis. Healthcare is becoming personalized, preventive, and definitely with the genomic analysis, healthcare is becoming more predictive. Why does the guy who drinks every evening, eats hamburgers, eats biryani, and still doesn't have the heart attack, and the vegetarian who hasn't drunk, who exercises every day, why in the world does he get the heart attack? Why does he get the MI? Why does the person who's on this 1,200 calorie diet just not lose weight, but her friend who's eating happily every day fits into a size 2 dress? These are the type of things which go to genetic makeup. So very simplistically, healthcare is changing with the 3 Bs, biology. The day the genome was deciphered and we understood the genetic makeup has presentation has impact on disease and the way that we react also to drugs as well as to food, diet, exercise, environment, that biology is the first B. The second is bandwidth. Today, sitting in Mumbai or sitting in Chennai, we can connect to the remotest villages. We have over 27 connections in one little area in the Northeast, one state in the Northeast alone, because otherwise these people would not have access to healthcare. In Himachal, one of the most unmanageable terrain, Kaisa and Kailong, is the world's highest telemedicine station, where in a government environment, we are managing their emergency room using telemedicine. So definitely the bandwidth and connectivity. The third, of course, is your IT industry's most favorite rule, is the entire thing about bits and bytes. Moore's law stating that your computing capacity is getting better and better. How that's impacting healthcare is the CT scan, where we started with the 16-slice CT, became the 32-slice CT, became the 164. Today, the 320-slice CT can do a calcium scoring marker and tell you whether you will have a heart attack in 5 years. This is amazing technology available in India today. Unfortunately, public awareness is average, but media says that 15,000 rupees for a scan is too much to pay, and therefore, even though you would pay $270 and call it a steal in the United States, nobody is doing the heart scan in India. So there's some work to be done in terms of public perception, people's acceptance, and the ability to partner in healthcare in a far more proactive, far more dynamic manner. I think besides the fact that the environments of care are changing, that care is becoming more patient-centric, I think one of the biggest moves which is happening is that care is getting extremely driven by data. And many of you will say, what's the big data thing in healthcare? But basically, the raw material which goes into the industry's engine of healthcare is actually data. It's data about your genomics, data about your cholesterol level, your liver function test, your renal parameters. It's data about the imaging on your X-ray, your CT, your PET CT, and it's putting all this data together to synthesize and create precision medicine, why data is becoming superbly important. And when all of you think of data in the healthcare industry, you think of AI. And some tech enthusiasts have said that data and AI will replace doctors. I want to put forward that I do not think for a very long time to come we will replace doctors. But I believe that technology and medicine working together in a paradigm of augmented, not artificial, augmented information, which will enable doctors to have data at the point that they want when they are treating a patient. And this data is the synthesized values of the outcomes of many, many successful treatment patterns. And therefore, imagine, in a country where we have only 700,000 doctors and we need to triple our doctor strength, grow by 5 times our nurses, and by 12 times our number of paramedics. In a country of this healthcare shortage, can you imagine if a fresh MBBS doctor entered his patient's symptoms and had with him an augmented intelligence prompting him, which came from 20, 100, 2,000 other senior doctors, and this was synthesized into a point of care, artificial intelligence or augmented intelligence enabled clinical decision support system. We're just beginning to do this, but believe me, today's kind of experiment is going to become tomorrow's standard of care. And therefore, it will enable this healthcare worker to up the level of expertise and capability like never before. India's experiment with the ASHA workers, 600,000 ASHA workers, a few of who today go to the bedside or to the home of people with a tablet. And in our village in Argonda, where we're taking care from birth through life, the entire life cycle of 70,000 people, were innovating with these models of how do we bring this data and decision making, how do we do real life teleconsults, and therefore enable care to reach the rural environment. Again, in a country of 1.3 billion people, we have only 940 neurologists. And those 940 neurologists live in only 37 cities. So how do we get this expertise into rural India, into the masses? How do we prevent migration of people who have a clinical problem? Let me tell you that in the last 3,000 consults in a small village in Argonda, 3,000 teleconsults, 87% of the people could be treated in the village itself. So I can go on with stuff like this, but let me move on. Telemedicine, connectivity, all genomics you've all heard, you know about. Everybody wants to know what are we doing in blockchain. And let me interface the power of this blockchain or the distributed ledger technology with the power of what's happening in government policy. In the recent budget, February 1st, when Prime Minister Modi announced that 5 crore people, actually 50 crore people, would have access to an insurance scheme. Can you imagine, if you can, 50 crore families and have 5 lakh coverage, if you can imagine how 40% of the population who could not afford healthcare suddenly now come under an umbrella of care. We've been working with health insurance and enablement from the year 2000 with the very first scheme in this country, which was a 1 rupee a day access in Argonda. And this was one of the happiest moments for me, because I know that health is the second cause of rural indebtedness. I know that people sell their wives' jewelry and pawn their land for the sake of paying for their medical bills, and it is unfair for us not to have a universal health coverage. This is a significant step. But if we just implement the step in the current day, we will move the way the rest of the world has done, where back-end processing cost of a third-party payer system take from 7 to 14% of the cost of healthcare. If India innovates and creates a new system using a basic blockchain technology, putting on top of it distributed database, disease prediction, an app engine, using sensors, put devices, put in a preventive healthcare, use the teledensity of our country and put the mobile phone at the access of personalized healthcare. This system that we're actually working and talking with the Government of India, with Niti Aayog, with many other partners. This system will enable that India has the lowest back-end per transaction cost compared to any country in the world. And this is a powerful, significant thing, because then every paisa of our limited healthcare budget can go into the direct provisioning of care. And I not just predict this will happen, I'm very sure it will happen. The ball has already started. And then, if you take the pharmaceutical industry, which again is under a lot of, a certain lens right now, you actually look at the pharma and the healthcare sector together. India delivers healthcare at global standards in most institutions, most credible institutions. I often describe India as islands of excellence in an ocean of inadequacy. But in most medical high-end institutions, we deliver world-class healthcare at 1/10 of global prices. Patients from 140 countries come to Apollo. We receive over 900,000 patients every year internationally. And this is because of the high quality and the good price. The problem of the pricing is related to the fact that there is no third party or insurance payer system. If you have to pay 2.5 lakhs for a heart surgery, it's too expensive for a school teacher or a policeman if they're paying out of pocket. But if they have to pay 10 to 15,000 rupees for an insurance coverage, this is affordable. So what we need is true business model innovation, true focus on not just the illness side of the industry, but the wellness and the prevention. And finally, we need to use technology so that we become smarter, more proactive, more predictive, more able to use the manpower and the women power that we have in this sector to build this new engine of positive care and treat our country, improve our own statistics, but also help to treat the world. This, ladies and gentlemen, is very simply the dream or the vision that we have. But let me also say, in this room full of technology people, that I think at the core of what we're doing is some tremendous heroes of medicine, which are our doctors, and some unsung heroes of medicine, which are our nurses and the technicians and the housekeepers, staff who actually play a role in infection control, who are very often not recognized. It is these people as well who will create this transformation, and it's for us to embrace. And thank you for that, and I will convey this to the healthcare sector, that engineering, technology, and investment does acknowledge the role that they play. Because just last week, a doctor started on a heart transplant program at Apollo Hyderabad. And the functioning of the donor heart was inadequate. He did not want to abandon the surgery. He knew this patient would die with his own heart, which was working at only 15% capacity. He did not want to abandon this organ, which had only 65% capacity. He created, which is only 1 in 10 in the world, a piggyback heart transplant where this one individual now has 2 hearts. It's a few days after Valentine's Day, but imagine the power that individual is going to have with 2 hearts. This is what India can do. This is what Indian healthcare can do. And so I truly call upon all healthcare investors and all healthcare technologists, please help us build this new app environment. I believe there's $43 billion which has been invested into Indian healthcare. I believe that there will be $570 trillion which can come into the healthcare tech and enabling system. But the one statistic I know, that if we, and I don't know too much about the investing world, even though we have these models and we'll be happy to look at what we can do. We've just started an accelerator fund. But what I do know is that if we leave the non-communicable disease, which is cardiac, nephrology, cancer, stroke, if we leave that unmanaged by these new methodologies, 600 young people are dying every day, most of them men in their most productive years, dying every single day of an unplanned, untreated heart condition. Because the pressure of today's life, the type of schedules, KPIs, and environments that you're creating, this always on world that we live in is creating a certain stress and tension. And so while I'm requesting all of you to take up yoga or meditation or anything that makes you feel good, please also have your checkups, and let's find ways to partner in this tech and healthcare environment so that we move into a happier, healthier future. Because I believe that we should not sit passively and let the world and technology happen to us. We should co-create this future where we use technology towards a healthier tomorrow. Because undoubtedly, many of you in this room, some of the millennials are going to live to be 100. Some of the largest population of old and elderly people are going to be in our country and this part of the world. What kind of a world, what kind of a healthcare system do you want to live in? And therefore, let's help co-create it. Thank you all very much. Thank you. I left some time because I know that the Chief Minister is almost
okay.
here.
We have another 10 minutes. But before that,
we can do questions.
Yes, but before that, a huge and far better round of applause.
Thank you.
Thank you so much, Sangita. As usual, you've left all of us more energized and driven to make a true change. We have time for a few questions, right?
We have time, and this has been truly inspiring and healthcare. Please go ahead. You have about 10 minutes, and then we got to break because the CM is here. Yeah. Can someone help and pass around mics quickly so that we'll take a couple of questions?
Yeah, please make your questions very crisp, yeah, so that we get more chances.
All the people who are standing near the door, I'm sorry, you need to move in. Just move in because their security doesn't want anyone standing on the periphery. So if you don't have seating space, just move in. Just move in towards the center.
Yeah, my question is, it is said that earlier doctors used to treat patients, now doctors treat reports. What's your take on that?
Well, let me start off by saying that the definition of doctor now includes Dr. Facebook and Professor Google. So patients are beginning to get a lot more knowledgeable, but the reports are extremely insightful. And therefore, I think one of our mottos across our training program is TLC. I believe that we must use the technology available, but never lose the human touch. In fact, one of the things that my father often tells his surgeons, that he says you're extremely skilled, you're super knowledgeable, and you've been to the best school, so your brain computing capacity is outstanding. And you've developed this skill because you've worked in so many environments, but let the path from the brain to the hand when you're operating travel through the heart. So I think that says it all for you.
More questions?
Anyone else? Yeah, the gentleman in front.
My name is Virendra Raheja. I'm here from Australia. Work for a media
Put the
company.
microphone closer to your mouth, please.
Sure. We have been observing new technologies, particularly with artificial intelligence and machine learning systems, which are now built into humanoids to actually help elderly, aged care, and people with dementia as a companion and carer in many ways. Do you see that kind of technologies coming into
So
empowering?
fabulous question. Thank you for that. I was at NASSCOM yesterday, and I saw Sophia, and somebody asked her, who would you like to go on a date with? And Sophia said, I'm 2 years old, I can't go on a date. So I think if we can train a humanoid to have these type of responses, we can definitely train them to do a number of things. So I believe that medication dispensation, chatbots, and companionism, because please remember that when we talk healthcare, we need to treat not just the body, but also the mind. And in India every day, we're having 300 suicides per day. This ability to use chatbots, robots, across physical, menial, and repetitive work, high-end work which can be slightly predictable, or contact-related companionship, I would put them into these three paradigms, and I think all of them have tremendous scope.
Yeah,
but for now, the immediate thing that we're doing is that in home care, we're putting a series of devices, a back-end medical call center, and we're monitoring home care environments using a general duty assistant who's had only 6 months of training, rather than a nurse who's had 4 years of training. So we need to tweak the business models to use the technology to keep care at high quality, but keep it affordable. And many of these will start there but progress into some of the things you're saying.
Yeah, we do have
And,
now empathy built into humanoids.
Absolutely.
I'm really sorry, but I'll have to break it here so that we have a few minutes before the CM comes in. But thank you so very much. And this was a fine panel, and it was very inspiring. Thanks a lot. One moment.
And to all the entrepreneurs in the audience, all the best and good luck to you in your personal journeys.
So the Chief Minister is here. He'll be here in a few minutes. I'll just request, just don't block any of the doors. Security protocols. So just, if you don't have space to sit, there's a lot of chairs here. You can come in here. Just remain seated. Just be patient. Just a couple of minutes and he should be here.
Thank you.
For all industry, because yesterday we had a very good, but for the last 2 days we have been having a very good,
Question. What is the
at,
question?
BKC at Magnificent Maharashtra. I
What's
would like
the
to
question?
specifically ask him, does he have any ambition or kind of a plan to set up a healthcare cluster?
Does he have plans to set up a healthcare
Cluster.
cluster in
It's a cluster.
Maharashtra?
It's a huge, it's an encompassed environment.
Question
for-
is,
yeah, only
does
for
he have
healthcare
plans
business.
to? Yeah, okay. I can't answer it for the CM. I'm just taking some questions. Yeah.
So the Andhra Pradesh government has a lot of partnerships with startups, right?
Sure.
And they're doing a lot of pilots with them. So
Sure.
where is that initiative from the Maharashtra government? Right? They're not all out doing that. Is there a plan to do so?
So what's the question?
The question is there a plan to have a kind of a dedicated team in the government to work with startups, to do pilots with them?
Okay, so is there a dedicated team from the government which will facilitate work with startups? Okay.
Thank you. Hi, I have a question here.
Lamp is ready.
Yeah, can I start? Yeah, hi, ma'am. I have a question, very small question, quick question.
Yes, please.
Like for service-oriented startups, like the challenge is, although there's a TDS, tax deduction as source of 10%.
Sure.
Now, most of the startups are, making very little money.
Yeah.
And whenever we get paid by the customer, 10% of my money gets stuck up. And TDS is generally taken as a compliance. For the manufacturing companies,
Question, please.
Question is, for manufacturers, there is no TDS. Why there should be TDS for software service providers?
When manufacturers don't pay a TDS, then why?
Should software service providers should pay a
Why do
TDS
software services?
of 10%? That also of 10% when we don't have so much margin actually.
Okay, fine.
Good question.
Guys, just tell me the question. I don't
Yeah.
want the
So,
whole background story. Could you stand up, please?
When we'll be looking at to Maharashtra state startup policy? We are awaiting that policy since long time.
You're waiting for the Maharashtra state,
startup policy, yeah.
Okay. Yes.
When will profession tax be removed? It's one of the taxes which should have been removed long time back.
Now ask him everything. Now ask him, when will the presidency in US change and all of that, right? Yes.
Any developments for improvement or empowerment of women entrepreneurs in Maharashtra?
So can you be more specific? Because that's a very broad question. Is there anything specific you're looking for from the government for women
So in terms of
entrepreneurs?
workspaces and finance provisions, generic, yeah.
It's very generic, but yeah, okay. Guys, I'm going to say this once more. Those standing near the door, can you move in? Or we just close the doors behind so that nobody's standing there. Sorry. No. Thank you. Yeah.
So currently we are working with Digital India.
Sorry, I can't hear you.
Currently we are working with Digital India.
Question.
Yeah. So we want to know what are the allocations of this current government, especially of Maharashtra, when they had magnetic event yesterday.
Yes.
So what is their allocation for the Digital India currently? So that we need to understand, because that was not explained in yesterday's.
What is the allocation of budget towards digital media, digital startups?
Digital India and especially in Digital India happening in Maharashtra, because they have not allocated any funds yet, especially for Digital India here.
Okay.
Hello? Yes. When government can
Sorry,
start a...
I can't see you. Who's asking that question?
Yes.
Yeah.
Like, previously government started BSNL, ONGC. So there are new technology come up. So when government can start new startup their own actually, because any new technology required to take off, there are a lot of execution required. So once new industry started new business, it also helps the other small entrepreneurs also. So government can also start a startup actually, for execution instead of just making programs and everything, spending money.
I want to know what is your question.
Question: when government can start a startup?
You want the government to start a startup?
Yeah, they can start the company like ONGC for the new technology, new area. Like, previously government started BSNL, such kind of government enterprise.
Do you have ideas around that?
Yeah, any area of artificial intelligence, IoT, healthcare, smart healthcare systems, where we face a lot of challenges about the, creating employment actually. How we connect blockchain of something. Okay. Thank you.
I have a question right here. Yeah, sure.
Yes, hello. Cluttered urban centers and growing environmental pollution is actually pushing, lowering the productivity of entrepreneurs and pushing them out of the country. Is there any plan to fix that piece? Because it's actually becoming a menace.
Okay. Also, I want to ask you, any of you have any specific ideas or a business plan which you want to present to the state government? Any specific, where, you see that collaboration with the government can help for the larger good or for the state?
Yeah, hello. Akanksha, here, this side.
Yeah. Where? Okay, yeah.
Hi. So one of the proposals is why doesn't the government start co-working spaces of its own and provide affordable spaces to new companies?
That's right.
Because I was talking to someone from...
Question, please.
Yeah, from Sakara Ventures, and they said that their government is planning 6.5 lakh square feet of space in Thane.
That's
so when is that coming up? So
when is that space coming up, right? They were,
Yeah, I have a question.
Just a moment, please. Hold on. Yeah.
Maharashtra has a lot of policies like IT policy, biotechnology policy, and a lot of policies. But there is a difference between what the policies are and how they are implemented. So and that leads to a lot of frustration, especially to the startups. So how would he take care of such problems?
Okay, so these are as many questions as I'll broadly remember.
Akanksha, I have one question. This side corner.
Okay. One question,
Yeah. The question is that startups are always boosted up and all, but when it comes up to government tenders, they ask for the PTRs and what are the previous financial backgrounds.
Right.
How will a startup qualify for the same? There is no provision for taking, maybe the startup is really moving ahead, but it takes years to go to a particular milestone.
Right.
For those tenders, what can be done by the government to take startups into mind and further pursue that, yes, they can hold good for it, even they do not have a good PVR.
Okay, so all excellent questions, but these are as many as I'll remember. Here's what you got to do.
How are you going to remember all those?
I'm an entrepreneur, I remember all these. Now listen, if you have any more serious questions and not as generic, if you have questions, one moment, just give me a moment to finish this. Yeah. Then what I want you to do is tweet with the hashtag Thai Global Summit, ask CM. Okay? And seriously, tweet those questions. You can tweet it to, the Thai Mumbai handle. You can tweet it to me. My handle is AKANCHAS. I repeat, AKANCHAS. That Akanksha, and S is for Srivastav. Just tweet, use hashtag Thai Global Summit, along with the hashtag Ask CM. Okay? But if you ask for specific questions, it will be even better.
Hi, this is Amit here. See, tourism is the maximum things which is sold online, but Maharashtra can still do much more ahead in tourism. It could generate a lot of employment also.
Question?
Therefore, what is the tourism plan, basically, where they can generate a lot of employment as well as startup opportunities in Maharashtra?
Any suggestions in this room full of questions?
The VVIP is here.
So, any suggestions, any specific suggestions? These are a lot of questions. Go ahead. Do you have a mic? Okay, the moment he walks in, we'll take a break for these questions, okay?
Yeah. Akanksha?
Yeah, go ahead.
So, any policy on rural entrepreneurship? Because we keep talking about entrepreneurs, but in the big cities, so there's Thai, Mumbai, there's so on and so forth.
We have 5 minutes right now.
Any policy on rural entrepreneurship from the Chief Minister?
Have you looked up and you haven't been able to identify with any of the rural entrepreneurship policies?
I haven't seen, I don't see too much of conversation happening on that, but maybe,
Have you looked up specifically?
No, I haven't, no.
Okay. I asked you that question for a reason. I want you to go and look up the rural entrepreneurship policies, especially in Maharashtra.
Sure.
Yeah? Guys, before you ask a question, I want to make sure that you've studied that background and you haven't found that information. Right? Yeah. So I know I got to stop the questions because he's walking in now.
Akansha, we need to verify that everybody here is actually a VIP. That is, you paid for a VIP ticket. We have 21 VIPs that will be walking in with our VVIP.
Yeah, we will need
So
to
if you
vacate
are not
some
an
spaces
actual
here, if
paid
you don't mind.
VIP, you can't be sitting here right now.
And some of you, can you shift this side? There are empty chairs here in the first row, if you don't mind. Let them come in. Guys in the first row will need to make some space. Can you move this side, please? Can you move this side? Quickly, please.
I have one non-VIP chair right here.
That's
everybody.
okay. We'll just keep
Thank
that
you.
empty.
Yeah, Akansha, excuse me.
Can you move this side? We need to keep that empty for the CM's entourage right now.
You're all paid VIPs. Yeah? Okay. Would you do me a favor? Well, okay.
I need this